And good morning, and dear members of parliament and colleagues and distinguished guests. First of all, thank you so much to be able to address this very important roundtable because breastfeeding is really a universal right for every newborn, as you already heard today. And today I speak to you not only as a pediatrician, as a healthcare professional, but also as a mother of 4 children whom I was fortunate enough to exclusively breastfeed. But it was not easy. It was challenging, especially with the first baby, because I delivered my first one in a non-baby-friendly hospital where breastfeeding counseling was not available. I had some medical complexities, and I also experienced, honestly, an attack by various promotional gifts of infant formulas. But I was lucky enough because as a pediatrician, I know the enormous benefits breastfeeding has, but also I had a sister who could immediately jump in and support me. And then I could continue with the 3 other child of mine with exclusive breastfeeding, which was one of the most wonderful bonding experience of my lifetime. But this painful experience that I drew to you became a constant reminder to me that over my 2 decades of working with WHO, together with UNICEF, and I'm happy that I can see the UNICEF representative Julia there as well, became a constant reminder that we need a system in place and we need supportive environments so everyone could have access to the direct support that they need to be able to breastfeed from the very first hour of delivery, after the delivery. Therefore, today, I speak both from personal and professional experience when I say that breastfeeding is one of the most effective, affordable, cheapest, and safest, because it is available, and impactful public health intervention ever known. And you already heard from distinguished speakers before me on these potential benefits, not only on the babies, but on the mothers as well. And our dear colleague, Dr. Larry from headquarters, will give you more concrete data numbers on that. But yet, there is one slide that you can show me on the background. In the Czech Republic, we face a serious challenge because almost majority of the mothers initiate breastfeeding, but exclusive breastfeeding rates drop dramatically in the following months. And by the time the infants reach 6 months, less than 20% are exclusively breastfed, which is well below the WHO global target of the 50%. And I hopefully can share those slides with you later on because I do not see in the background. But this is a phenomenon in the European Union where we experienced one of the lowest exclusive breastfeeding rates recently. And this drop-off isn't just the statistics. It represents a missed opportunity to protect children's health. And WHO and UNICEF recommendations are clear. These are global recommendations backed by decades of research and numerous World Health Assembly resolutions. Among them is the International Code of Marketing of Breast Milk Substitutes. Let me be very clear. The code itself is a recommendation because all of our WHO guidance are recommendations. So while it is not legally binding, but it is a globally endorsed public health instrument that countries are encouraged to implement through national strong legislation to protect mothers. Because we must urgently confront the increasingly sophisticated tactics of the breast milk substitute industry that already using digital platforms to directly target mothers, especially in very vulnerable moments. And they erode confidence in one of the most natural and beneficial acts a mother can provide. But at the same time, of course, we have to be realistic that not every mother are able to breastfeed at the beginning. Some may face medical complications like I did. They might have lack of information, lack of support, or even lack of confidence. And that is why it is crucial that we create a supportive environment. What does that mean? It means that we train all healthcare providers to offer breastfeeding counseling. We also ensure community support, peer counselors, lactation consultants available, even mothers-to-mothers groups. We have to ensure that maternity unit follows the baby-friendly hospital initiative. And most importantly, we really have to reinforce policies that protect all the mothers, those who breastfeed and those who cannot. But let me conclude with this. As you know, breastfeeding has overwhelming, very clear, huge potential benefits. It requires no factory, no packaging, no marketing budget at all to continue and to support, but it definitely does require political commitment, investment in health system, creating empowering environment, and protection from harmful industry practices. If we would like to give every child in the Czech Republic the healthiest possible start of life and support every mother in making the best possible informed choice, we must act together now. And that is why I'm very grateful to having this roundtable today and have all the key stakeholders discussion. And I'm looking forward to the debate today so we can together support that the breastfeeding rates are increasing in the Czech Republic as well and protecting our children's health. Thank you so much. Děkuji.